Hello everyone, hope you're doing well. Welcome back to our YouTube channel. My name is Esther, your nutrition consultant, and we said in this channel we are here to learn, unlearn and relearn. So today we are back with an exciting video. It's very educational. It's all about creating awareness, and we are going to do topics that touch on first-time mothers and teen mothers. Last time when we were doing the video, we say like we are going to support the first-time mothers and teen mothers to help them at least overcome some common challenges that they will face during pregnancy and after delivery, for themselves and themselves and the babies. So let's learn together and enjoy this session. So let me go to the first thing that we're going to discuss about. We are going to start with the pregnancy challenges that mothers or first-time mothers face, and teenagers as well. Sometimes they become so challenging to them because them be the first time mom or a teen mom. It's very hard for them to know what's happening to themselves, to their bodies. They face some complications that they don't know how to deal with them. And I will touch on a few common ones that we need to know. But as we continue learning and relearning and unlearning, we'll get to a point whereby with time we'll be able to tackle on these topics. So for today, I'm going to start with the common ones that we face as mothers during pregnancy. So the first one that they always face is issue on nausea or discomfort during pregnancy. You find a lot of mothers, they struggle with nausea, which is mostly but it comes as a symptom of like you feel you want to throw up, like you want to vomit. That's one is a very common challenge that mothers face. And there are simple tactics that you can always use, especially when you have the nausea. You can use them to lower down the nausea or control it. So the first one, you need to use like the crackles, the chewing gums, and the crunchy foods, the crunchy foods, and especially the ones that are not so sweet as well. So it helps you to lower down that nausea when you feel like you want to throw up. And also because most of the time it happens in the morning when you wake up, so you can always work on your waking up positions. Like when you are waking up, just be slow, take your time, just don't wake up from the bed and just you step down and start doing 1 2 3. It's just good you be slow on your movement when you're coming out of your bed. Like you wake up first, you rest, you sit on the side of your bed, then from there you are able to continue with other duties, like you can go on with what you wanted to do on that. And in this nausea, I can also talk about some issues that comes with together with those nausea. Like there are these people who during pregnancy they have some cravings. So cravings is a situation whereby you feel like you really want to eat so much of these, like your body is very choosy, you want to eat just a specific type of food, you want just to do something specific. That's what we call craving. Like you just want to do that, like you overlike it. We can say like you overlike specific thing. That's what we call like cravings. And also in the same situation, there are people who have things we call like aversions. Aversion is whereby you really dislike things, like you feel you can't stand a certain thing. Like most common ones, like when you are cooking, you feel you can't stand the smell of the onions, you stand the smell of perfume. Those are what we call aversions, and they are very common. They are very common and normal, so it's not something bad. Some people go to an extent of maybe disliking their husbands, their mother-in-law, like things like that. It's very normal, guys. Don't be like stressed over it. So something normal. With the time, it passes and you continue with life. Then we have something we call pica. Pica is whereby you are craving for things that not food, like they are not food, like you crave for to chew papers, chalk, those things, soil. Those people like eating a lot of soil. Yeah, those are common things that you'll face when you are pregnant. So when you come across them, don't feel like, what's this, I don't know, how am I going to go about it. And for these cravings, they always have an indication also in your body what you are craving for. Yeah, it means there is a nutrient that's also missing in your body, especially those who crave for the soil. You need a lot of iron in your body. So those cravings also tell a lot about your body. So once you have them, it's good also always to consult your doctor and to know what might be missing in my body, and you'll always get a solution for that. But we say it's common. Don't feel like I don't know how to handle this. It's something that's very common. So yeah, and you need just to be yourself and feel like it's a journey that I will overcome. Yeah, and also something else that mothers always face during pregnancy are like the sitting positions. Sometimes they are very difficult for you. You don't know either to sit down, either to sleep, either to walk. Like it's just a combination of problems and challenges. But don't get worried about them. We say that you'll always overcome them. Learn how your body is responding to different things, and see possible ways on what to do, so that you don't harm your bodies as well. So you need to be careful, to keep at the back of your mind, this is happening to my body, and if this is happening, if I have a backache because of sitting in this position, can I change to another different position, so that you're able to control your body for that period. It's just 9 months, and after that you'll just be okay. Yeah, there are also other mothers who get blood pressure during pregnancy. Yeah, it's very normal as well in that. So this hypertension or increased blood pressure comes because of the increased weight of the baby that you are gaining from the baby growing, or also by yourself. You find sometimes you are adding weight when you are pregnant. So it's something that's very common. The hypertension or the pressure comes when you are pregnant. Then after that, after delivery, it always goes away. Although for some patients it delays for some period of time, but with time it is maintained by the doctors and totally goes away. So don't be worried when your pressure is very high not very high, but it's at least high. But whenever it's very high, you need to always consult a doctor to give you a solution to that. So for pregnancy period, that's very common, and you need to know it's there. Yeah, don't be like, what should I do, what can I do, it's my first time be a mother. And yeah, we continue learning as we remember also other pregnancy challenges. And then after delivery, we always have breastfeeding complications that mother face, or challenges that they always face. The first one and the common one is about breast attachment and suckling of the baby. Like you really don't know what's the right thing. How should I hold the breast for my baby? Which position should I sit when I'm breastfeeding? Is the baby getting enough milk? Like you have a lot of questions in your mind, like what should I do? How should I suckle my baby? How should I attach the breast to the baby? Yeah, so these are things that you just need to get some information from the doctors before you leave the hospitals. If you really don't know how to do it, don't leave the hospitals or the facility before you are told, you are given the answer. Like if you don't know, you need to ask. They will always tell you these are the right position, this is the right attachment. And in that, just to be brief, first thing when you are doing attachment and suckling, that's when you are feeding your baby, you need to always sit upright. The first position is be upright. Whatever where you are seated, you have just to be very upright. Then when you are putting the baby on the breast, make sure the baby is next to your breast. Don't let your baby be very far from the breast. So you need to lift up the baby. If you can't lift up them, you can put something or a pillow on your laps, and it raises the baby up so they are able to reach on the breast. We'll be doing a video showing different breastfeeding positions. We'll be together in that. I will just do it like a full video so that you are able to understand different breastfeeding positions. But the quick one is just raise up the baby, attach the breast, and make sure the black part of the breast is inside the mouth of the baby. Don't let the baby suckle the nipple only, because that also leads to other breast complications, which will also study them in a different video, because in this one we can't do all of them. Yeah, so that's just a quick one on that. And the moment you don't breastfeed in the right way, there is always breast complications that comes afterwards because of poor breastfeeding and suckling position. So don't let your breast to get to that point. Then after you do the breastfeeding challenges, then here comes again, the baby is there, you are dealing a lot of, like, you don't know, oh, what's the right thing I need to do for my baby? Like, how do I hold the baby? It's so tiny. How do I hold the head? How do I control this baby? So the first thing when you are holding your baby, and when you are doing the breastfeeding, you always need to control the head and the neck of your baby, because they are very delicate. Yeah, you need to hold the head well and the neck as well. Always control them to make sure they are in a good position, not to harm the baby, and that one will be good with you. Then the other thing, learn to do the baby massage. The babies, they also get tired as we, the big people, so you always need to do some massage for them, but gentle ones. Don't put a lot of pressure on the baby, just very gentle ones, especially after bathing them, and then you massage them, then you let them rest. So you need to, that's a good care for your baby. It gives them enough sleep, it gives them rest, like just a peace of mind when you when you massage them. So they always feel that good mood, and then they are able to sleep for a long time, like they don't have some issues with sleeping patterns, so it improves their sleeping patterns. Then there is also something that's very common mothers deal with, what we call the baby colic. The baby colic is, it's a situation whereby you find your babies are always crying, and it's always very regular, like it's on a specific time. And for most babies, it happens at night. If this baby has colic, you'll find them crying either at 3 a.m., 2 a.m., 1 a.m., like at night. So that's when you know this a baby colic, because we also have other reasons why the baby might cry, but to know it's a baby colic, you find the pattern is very regular. It's either at night at a specific time, and every day you'll find, if it gets to Tuesday at night 3 a.m., Wednesday 3 a.m., it's very common they cry for a period of time, and they are showing a lot of pain. This is how you know your baby is going through colic. One, we said it's a very regular crying pattern. The other one is like you see they seems to have a stomach disturbance, like their stomach is really disturbing, like how you behave when you have some, like when your stomach has bloating. Yeah, like you're bloating because you took something that's acidic or something, so you find your stomach is filled up with gas. That's what we call baby colic. We say it's a regular pattern of crying, and you will see those signs. The babies try to throw their arms away, the legs away, rolling the stomach. That's when you'll know this is a baby colic. And this is caused by poor attachment during breastfeeding and suckling. The moment you are breastfeeding in a wrong position, such that the black part of the nipple is not inside the mouth, you'll find some air is getting into the baby's stomach when they are breastfeeding. So it goes to the stomach, it fills it with a lot of air inside that. So you find it bloats up the stomach. Now that's what causes the baby colic. And you need to do, what you need to do is that after breastfeeding your baby, you put them on the shoulder, bump them at the back, then they throw up some air that ain't got in when they are breastfeeding. It will come out with some milk like a foam. Then now you'll know at least it helps you to control this colic. We'll also do another full video of how to take care or maintain a baby who has developed the baby colic, things that you do. But just on this one, don't give your babies those things. Like when they have colic, there are those medication you always say, oh, we give them grip water, we make some solution of salt and sugar and warm water and we give them honey. No, that's not a solution to baby colic, because they just act like painkillers. And after some time, the pain comes back again. So we'll deal with baby colic on another different video. So then after delivery, mothers always have some, depending with what's your environment, how was your environment during pregnancy and after delivery. There are those mothers who get postmortem trauma, like they have a challenge with accepting themselves or dealing with afterbirth. Like that period, you feel like I've given birth, I don't know like what to do, I did not expect this, a lot is going in my mind, I don't know. Like that's what we call postpartum trauma in your, like as a mother. Some get it, some don't get it, depending with the environment and how you are treated after that. So one thing to avoid on this trauma, you have to be in a very, we can say a very comfortable and safe environment that's not affecting you mentally. It's also physically you are fine. And then the care that you are given after delivery, there are those people around you who need to show you some care, some love, some support. Either it's your spouse, it's your family members, or just the close person that you are living with. So if you are not given this care very well, you will always have that trauma. Like you go through a lot of trauma after that delivery. You feel like some mothers even go to an extent of thinking, why did I have to give birth to this baby? Did I have to go through all this stress and all those questions? Yeah, so to avoid this is their self-care, being a safe environment where you are really supported. And apart from the support from other people, you need to give yourself a very good personal care. A good personal care is whereby you know you are a mother, you have delivered, you need rest for yourself. Don't just get out of the hospital today and tomorrow you are in the kitchen cooking, you are there cleaning and all those duties that you need to do. In fact, we encourage just like 15 days after delivery, you need just to be in a resting mode. Just be a mother, just breastfeed your child. Anything else is just done for you. It's just to give you that nice environment to recover from the delivery process that has happened, the pain that you have gone through. So at least 15 days rest, always just resting, not doing any house duties and anything else apart from breastfeeding your child. So mothers, you need to be careful with that, because if it's not well taken care of, it really really brings down your mental health, and you might lead to a depression also if it goes, yeah, it goes so deep. So it's good at least you take care of yourself, apart from the other people taking care of you. Yeah, so that's something that you need to be careful so much, because it matters for you and your baby as well. Yes. Then also, something I want to tell mothers, especially first time mothers and teen mothers, is about getting pregnant after delivery. Immediately after delivery, you need to know that you are very fertile as a woman. You need to know that. So the moment you engage yourself in some sexual intercourse activities, just know that you have very high chances of getting another pregnancy. And remember, you have just delivered again, now you get pregnant again. How are you going to deal with that, mother? So be careful so much. Well, after delivery, if you're using family planning, we always encourage just have your family planning back immediately, such that it helps you not to get pregnant immediately after delivery. And also we encourage breastfeeding, because it acts as a natural method of family planning when you are breastfeeding your child. So the moment you deliver, also continue breastfeeding as many times as possible. It really helps you. It's not 100% method of family planning, but it also supports you to get pregnant. So kindly mothers, be careful with that. After delivery, if you're using family planning, kindly put on your family planning to prevent just getting pregnant immediately after you have just delivered, because you'll just be like, now what are you dealing with? Are you dealing with a baby? Are you dealing with yourself? Are you dealing with another pregnancy? Or what are you dealing with? So it's good to be careful about that. Then let me talk about something that you also need to know as mothers. First, when you are pregnant, you need to know this: don't take a lot of carbohydrates, don't take a lot of fatty foods, because the moment you are taking them, you keep on putting a lot of fat deposit in your body, or increasing on your weight. And when you're going to deliver, this one becomes a struggle for you, because you need to be flexible to deliver your baby naturally. It might force you to have a CS, which is not that good as well, because CS, again, you have to act to deal with the delivery wood that will be made for you, the baby, to be removed through CS. So it's just good, watch on what you are taking during pregnancy. Avoid taking a lot of carbohydrates and a lot of fatty foods. It will be a challenge for you during delivery. So kindly work on that. Take any other foods, but the carbs and the fatty foods and the oily food, always avoid them as much as possible. Then let's talk about the last one. We are going to talk about baby carrying, or baby care, although not the full process of baby care, but the common ones that I've seen mothers make. First, the common mistake that I've seen mothers make is how they carry the babies using the baby carriers. You find like you just bought a baby carrier to place your baby, to carry them. The modern ways of carrying the baby, not like how our parents used to carry us with a lasso at the back and just tie us around. The baby carriers, when you're using the baby carriers, you need to be very careful with them, because you find like you are placing the baby there, one leg is on this side, the other leg is on this side, so it really hurts the baby in between the legs. So you need to be careful with using baby carriers. So don't don't overdo them, or not every time you are going just somewhere, just a baby carrier, anywhere a baby carrier. There are these new baby carriers, or the swaddling, the one like they roll, the swaddle, I think they call it the swaddle. It looks like a long sheet that you just take your baby, you roll at the back of your, at the back, in front and backwards and all that. I think that one, I will encourage that one to be used, because it's a better one. It holds the baby well and better compared to the baby carrier that you just put the baby and just lock like the bag, like the backpacks. So I think that one is not really good for you to use on your baby, and especially when they are growing and they're adding on the weight, so they become so heavy and they are just sagging or hanging on those baby carriers. So we can try to minimize using the baby carriers, especially if the baby has added on some weight. So for today, you'll just allow me to finish our video there, because on the topics that you have touched on, there are some that need again a second session, or either if it's breastfeeding challenges, we need to do breastfeed challenges, how they come, how do you overcome them, how do you deal with them. So I think they can't all fit in this video, so we'll be doing them on a different other video, most of these of what you have touched today. But today I was just briefing you about this. In case there is anything else that you want to know as a first-time mom or a teen mom, kindly make a comment down there and just say, we need to know about this. We'll be here to deliver, to create awareness, to make those who don't know about it. And yeah, and also for the new mothers, I really want you to be like so active on this session, because it really touches on you. We said this all about learning and relearning. So every time we have a video, at least you are learning something, you are learning something, and you are relearning something. So thank you very much for your love, yes, and for your support. Continue watching these videos and always comment on what next you want to touch on. But let me say this, on the next video, what we're going to do is the nutrition for men above 40, because there is a client who had requested for that, or a fan of ours had said you can kindly do a session for us on nutrition for men above 40. So men above 40, next session will be made for you, and not only for men. I'll just be doing both men and women, because we say this nutrition, we have different ages that we need to go for: the pregnant mothers, babies, the adolescents, and then the middle age people, and then now the elderly. So we are going to do a video for people above 40. That's the session we're going to do on the next one. To continue seeing these videos, guys, always like, subscribe, comment, and always share with your friends, so that they are able to get this information. Don't stay with this information alone. Don't be selfish to yourself, because we are here to learn, all of us. So share with your friends. And for now, bye bye, see you on the next one, and we love you so much, guys. Let's grow this channel together.